know, deep down, I think we all know that no one is perfect, but it's a lot easier to say it than it is to really mean it.
So what's a person to do when they feel like their body isn't exactly the way they want it to be? You might be surprised at the steps some teenagers have taken. Take a look.
I'm not really for it or against it. It depends on the person.
If the person feels like they should do it, then they can go right ahead. It's their opinion.
I mean, you are what you are, and I don't think you should change it.
I'll consider it. Yep.
So stupid. That's like a fad.
Just what is it that has this group so divided? Believe it or not, it's a debate about plastic surgery. Surprised? Teenagers actually considering plastic surgery? Well, they're not just considering it, they're doing it.
I definitely think there's an increase in the number of teens having plastic surgery, elective cosmetic surgery, partly because of the increased interest in body image and so forth, but also partly because there's more attention to it, so kids are more aware of it, and their families are more aware of it than they used to be.
Dr. Michael Wotnowski is a surgeon who sees teenagers come in for all kinds of reasons.
Probably the very most common procedure that teenagers have done is a rhinoplasty nose job, and both men and women, breast reduction is a very, very common procedure that we do, and it's a very common problem. Other procedures we do are liposuction procedures, and then the other thing we do is ear pinning. And that's something we not only do in teenagers, we do in children.
Kelly O'Hara is 13 years old. Just a few months ago, she went to Dr. Wotnowski's office to talk about getting her ears pinned back.
My ears really stuck out when I wore my hair up, and even when I wore my hair down, they stuck out. And a couple of people had said to me, you know, your ears stick out from your head, out of your hair, and that kind of bothered me.
This is Kelly before surgery, and this is Kelly after the procedure.
I really like it. I feel like I can wear my hair any way I want, and my ears don't stick out, and I don't get comments anymore.
Even her mom, Cindy, has noticed a difference.
I think she has more confidence because of it. I think she feels better about herself. I think she's even a little bit more outgoing. She feels real good about herself now.
Becky Hannick will head off to college next year, but before that, she wanted to get something taken care of that had always bothered her.
I was always self-conscious of my chin, and no matter, you know, it would always bug me when I'd be like looking at my pictures of myself or whatever, and I never knew there was anything could be done for it until I was talking to a friend of mine who's a doctor, and he told me about it.
Becky's friend was talking about liposuction. This is when a vacuum-like device is used to remove fatty deposits. These are Becky's before pictures, and these are after. Like Kelly, Becky was thrilled with the results.
When I used to have this with my chin, I was always self-conscious, and when I was about to take a picture, you know, like, I have to make this so it's not there, stick my chin out, or put a hand there so it doesn't show up, and now it doesn't bother me at all. I feel much better about myself.
So, does this all sound too good to be true? You go in to see the doctor and you come out a whole new, happier person? Maybe, maybe not. Before you run out to make an appointment with a plastic surgeon, listen to this.
I think that there are legitimate psychological problems that teenagers and adults can have, and that can't be corrected by plastic surgery. And that's my job to ascertain that that's not existent. And that's part of the initial consultation. And that's why we sometimes see patients a couple of times before surgery to make sure that they do have a realistic understanding and realistic expectations, because you can't correct a psychological problem with surgery.
So what's the bottom line? If you're considering plastic surgery because you want to look like the latest supermodel of the moment, or you think it will suddenly make you the most popular person around, you should spend a lot more time thinking about it. Ellen Casper is a psychologist who has some tips for you.
I would ask myself, what do I like about myself and what don't I like about myself? And what do I think fixing this body part will fix about my general personality and self-esteem? And I would spend a lot of time with that question, because having strengths and weaknesses and learning how to accept both is an extremely important aspect of healthy development. And teenagers need to learn that being imperfect is a reality of life.
You know, there is one more factor in the plastic surgery equation, the cost. If you're having it done for medical reasons, insurance may cover the bill.
But if your surgery is purely cosmetic, you could wind up paying anywhere from $2,000 to $6,000, depending on the type of procedure you have done.
Well, coming up next, we're going to talk about how you can tell if your body image is so negative that you're headed down a really dangerous path, physically and emotionally.
Stick around. We'll be right back.
Stay where you are. Later in the